Great. Well, good afternoon, everyone. Happy New Year. Welcome to Trust for America's Health, Age-Friendly Public Health Systems, or AFPHS, January training. This is our first training of the year. We're very excited to have you join us for Reframe Aging, talking about a generation's work and how we can communicate better about healthy aging. We're really happy that you joined us. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Cron Phillips. Our movement, the AFPHS movement, would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Next slide, please. So we do ask that you keep your devices muted during the presentation today so we can avoid background noise, but please feel free to add any questions to the chat throughout the presentation, and we will have time at the end for some conversation. Next slide, please. Your feedback is really important to us, and so we would ask that at the end of the presentation today, at the end of the session, that you take a moment to complete an anonymous feedback survey that will just pop up at the end of your on your screen when we're done. Your insights, your responses will be shared with our evaluation team at the New York Academy of Medicine, and it will really help us to enhance our future trainings. Next slide. So most of you, I think, are familiar with Trust for America's Health, or TIFA, as we're commonly known. For those of you who don't, we're a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and our Pain in the Nation report. On healthy aging, we produce several reports as well, although not quite as frequently as the TIFA reports. And our topics have included housing, rural healthy aging, and the one you see captured on the screen here is on aligning the 10 essential public health services with our AFPHS 6Cs framework. Those are all available. The TIFA ones on the TIFA website, tifa.org, and our AFPHS resources are at afphs.org. Next slide, please. So again, welcome. Happy New Year. Welcome to 2025. Each year, those of you who know us and have been with us for a while, we like to start our session with a training on ageism as a refresh, and also to learn new strategies and tools to ensure that we are all approaching aging with a positive perspective. I just turned 67 last month, so I'm very positive about my aging. Today, our speaker is Alicia Klaproth, the Communications and Client Services Manager with the National Center to Reframe Aging, with whom we've been partnering for many years now on this work. The center has been at the forefront of changing the narrative about aging and teaching us all how to be better communicators when it comes to older adults and healthy aging. So Alicia, I will turn the platform over to you. Thank you so much for being here.
Thank you so much. I'm so excited to be here. Like Megan said, my name is Alicia Klaproth. I'm the Communications and Client Services Manager here at the National Center to Reframe Aging. I'm thrilled to be talking with you all today. So let's get started. Oh boy, this was going, there it goes. It was testing us already. So before we get into it, I just wanted to chat with you all about what you see 10 years from now. What's the headline that you want to see about services and supports for people? If you can throw that in the chat, I would love to see what your vision is. One of my favorite headlines that I always hear is uh, nursing homes, the premier place for aging, fully staffed. Any headlines that you could think of? Continuum of affordable housing opportunities. Yes, affordable housing, that's a big one. Anything about more funding for in-home services. Yes, aging in place is a big one too. In-home living for seniors. Yeah, I've been hearing a lot about aging in place, definitely having that opportunity. Older Americans are a force in the economy. Awesome. We all need supports throughout our lifespan. We are all aging. Great reframing. Aging is aging well is possible for all. Affordable housing, intergenerational activities on the rise around the US. Great one. US cities, best place to age. Yes, anything about improving mental health. Mental health is a big one across the lifespan. Fully funded door-to-door transportation. Yes. I just had a conversation with my boss about how we all pay for Medicare at age 65. Medicare should cover all supports if we're required to pay. Stay in home care, universal access to healthy lifestyle opportunities. Yes, access. All right. Well, let's talk about how we can start to hopefully make some of these headlines a reality in 10 years or more. I'm going to be patient with the clicker today. Try one more time. Doesn't want to let me control your screen. Ah, there it goes. All right. Alrighty, so just to introduce us, if you haven't been familiar with the National Center before, we are dedicated to ending ageism by advancing an equitable and complete story about aging in America. The center is a trusted source for proven communication strategies and tools to effectively frame aging issues. It is the nation's leading organization cultivating an active community of individuals and organizations to spread awareness of implicit bias against older people and influence policies and programs that benefit all of us as we age. I don't know if it's letting the shared control work.
Yeah, so maybe if it's
Yeah, I think
easier,
I'll
it'll
just pass it
be a
over
little
to you.
smoother. Maybe we could have Karan go ahead and just
Yeah,
advance the slides. Yeah.
sounds good to me. Alrighty, next slide. Thank you. All right, so to get started, I want to level set here and talk with you all about where we started and where we're coming from. So, we are a part of the 10 Leaders of Aging organizations. We're led by the Gerontological Society of America on behalf of these organizations. And the way that these organizations all got together was that they wanted to start discussing their shared challenge. People weren't understanding their work or the importance of the programs and policies they were advocating for. And they realized the problem was ageism and the many challenges it creates. In order to confront ageism, we need to understand what lies beneath it. And that's what they all came together to do, is to work with the social science experts to figure out what was underlying ageism in our society. And those experts were our research partners, the Frameworks Institute. So the Frameworks Institute is a research organization devoted to figuring out how to communicate more effectively about important social issues. The Institute is a nonprofit think tank with the mission to advance the nonprofit sector's capacity to reframe social issues. It conducts a range of original scholarly research on the communication aspects of social and scientific issues. They were also recognized in 2015 for the MacArthur Award for Creative and Effective Institutions. The original research conducted by the Frameworks Institute has been distributed by the National Center for Educational Purposes. And then, of course, we always like to give a wonderful shout out to our amazing funders, the four national funders that support the National Center financially and by helping us promote all the work that we've been doing. So on the next slide here, we're going to look at this map of all the ways that we all have a role to play in changing the way we talk about aging and addressing ageism. I have filled out some of the circles, and I want you to imagine throughout this presentation where you fit in these circles. I want you to reflect on how you can contribute to this movement and how you have influence in this movement in your professional and personal lives. So on the next slide here, we're gonna all get on the same page about ageism. So I'm sure that maybe some of you or most of you have had an idea of what ageism is. You've maybe heard it in passing or you're an expert on it already. But I want to make sure we're all on the same page. So the way that we define it is we use the World Health Organization's definition, which defines ageism in several forms. How we think, feel, and act on aging. And you can see that if you click one more time. And this is directed towards people on the bias of their age. So when you're looking at those definitions, go ahead and think about that. You can click two more times. This definition also includes consideration of how ageism shows up on multiple levels. So if you click one more time, you can see how that's kind of pulled out there. So interpersonal ageism. This arises in the interactions between two or more individuals. So if someone says, "Oh my goodness, you look great for your age," that counts as an interpersonal one. Compassionate ageism. You could think about this one a lot in the healthcare field with elders speak. "Oh, honey, how are you feeling today? How are you doing?" That baby talk. Institutional ageism, you can see some of this in those forced retirement ages. I believe somebody said in their headline, the mentioned the workforce, and this is a big one for that. And then that last one here is self-directed ageism. When we're hearing all these different forms of ageism, it starts to impact how we think about ourselves when we're aging. So if you've ever heard anybody say, "Oh, I'm too old to pull that off," or "Oh, I'm too young to pull that off," that's that self-directed ageism. And then the other part of that on the next slide is underlying ageism is implicit bias. This is also called unconscious bias. These are the attitudes and mental models that are activated automatically without us really realizing it. This is the implicit associations that we harbor in our subconscious, and they cause us to have feelings about other people based on a range of characteristics, on race, ethnicity, age, on their appearance, and we're pulling these all over a course of a lifetime from a very young age. If you think about at a young age, we're watching cartoons, and a lot of the cartoons, the villain is an older person, right? And there's really bad stereotypes about older people in these villains, right? So we're seeing that in a really young age. And the research found that exposure of implicit bias and just knowing about it helps to reduce it and starts to help people be educated on the subject and helps us to be less likely to act on that implicit bias and more likely to treat people fairly and to spread the word about it. So I'm going to ask you on the next slide to share what your current story is that you've seen on aging. So I know I put some examples here. You see those birthday cards a lot. It's actually kind of hard to buy a birthday card that isn't ageist. I'm always having trouble buying a birthday card. I usually just buy one with a picture of a happy face or a cake on it. Um, so I wonder if you in the chat can share what you've seen about it and think about what these examples are bringing to the public conversation. How are we talking about ageism? What does that look like in the environment around us? See, I'll check the chat here to see if anybody's got any examples they can think of. I know the birthday cards are a big one. The election campaigns, yes, yes. And if you checked the National Center as well, we had to have a number of webinars on it because the conversation was so huge about ageism in the campaign, whether it was a presidential one, or other smaller campaigns, other seats that were available. It was a lot. Let's see. The anti-aging products in magazines, exactly, exactly. The okay boomer, that's been a big one. So you can see these jokes and these things that people say, they think that they're minor incidents or sometimes even bigger incidents, but they can get in under our skin, even if we're just looking at them in passing, and not only impact how we think about others, but it impacts how we think about ourselves, right? That self that I was talking about earlier. Ageism and misperceptions are pervasive and have a widespread impact. We talked about it in the chat, workforce discrimination, the limit on our ability to contribute as we age, and of course that ends up in less support for policies. If we don't want to talk about aging, or we're going to talk about aging in a negative way, we're not going to want to invest in aging, right? That's the way that the story looks right now. So, what does it take to reframe an issue? On the next slide, we can talk about what the Frameworks Institute found in their research and how they mapped out that terrain. So, they to do this, the Frameworks Institute wanted to get into the public discourse. What are the gaps between how experts think and talk about social issues and how the public thinks about that same issue? Then the Frameworks Institute developed and tested some strategies for filling in those gaps. They went out and they talked to folks and they wanted to disseminate those strategies as well to build experts and advocates' capacity to share and and tell a coherent, well framed story about the issue and find a way that we can all be on the same page about this issue. So that's what we're going to be talking about today, that dissemination piece. How can we all communicate about aging in the same way and be on the same page about it so that we can start to get people invested in aging and start to think differently about aging? And then we're going to use those strategies, and I'm going to share with you those strategies from the Frameworks Institute. So let's talk about what they found in their surveys, talking with folks on the next slide here. So when they mapped that terrain, they talked about, like I said, with the professionals and with the public. And with this graphic here, you can see some of those big differences. The ones that I like to pull out to highlight the most are this first one here. How should we approach aging? So that people in the aging field said, I love aging. We should embrace aging. Megan shared earlier, she just had a birthday and she said, I love my birthday. It's the best. Versus the public, some of the general public say, oh no, I need the anti-aging cream. I don't celebrate my birthday. Don't tell me about how many candles are on my cake. All right, the other one that I wanted to share is how big of a concern is ageism? Let's highlight this one. So, folks in the aging field, it's a big concern. We all want the policies and programs that we need as we age because we're all aging. Versus the public, some people don't want to even say that they're aging. In a lot of presentations, we ask folks, how many people here are aging? And not everybody raises their hand, but we are all, in fact, aging. I'm aging. Um, my 10-month-old son is aging. We are all aging. So we want to make sure that we have some of these reactions on the back of our mind when we're talking about what we can do and why framing matters. So on the next slide, let's talk about what reframing and ageism is and how important it is and why framing will matter when we're talking with people about aging and age inclusive policies. Framing makes a big difference on how people understand your message, and it's a critical part of social change strategy. We're all communicators, even if it's not in your title. We're communicating all the time, and all those various models of communication, we're making framing decisions. So let's talk about some of those framing decisions on the next slide. We'll get some examples and get all on the same page about how we all make frames. So frames are sets of choices around what to emphasize and how to explain something and even what you don't want to tell people, right? So everybody frames. So think about the last time you were talking with your buddy and you said, we all want to go out to eat somewhere, and it's our New Year's resolution to go out more, even though it's cold. So you unconsciously made a choice of what you want to emphasize. And then you told them what you wanted to explain. This restaurant's the best. Let's go to this restaurant. It's going to be really cool. And everybody talks about the great reviews. And it's just got this chocolate cake that I just got to have. Okay. Then we made another choice of what to emphasize. Then you made a choice about what you didn't want to say, right? It might be super expensive. There's going to be a line. It might take an hour to get there. We're going to probably be in traffic for a while. You made all those framing choices strategically. And so we need to be aware of how our communication choices trigger certain patterns of thinking. There are certain frames and patterns of thinking that work against the messages we're trying to get across. If I told my friend, you know what, you want to go out in the cold to a restaurant that's going to be super busy where we're going to spend a ton of money, that's probably not going to be a yes to go out. So we want to be intentional and deliberate about the frames that we choose. And then you'll see if you click what to emphasize, you click again, how to explain, and click again, what to leave unsaid. Alrighty, so let's talk about how changing mental models and ways of thinking about aging create system change on the next slide here. Alrighty, so when a frame works, knowledge about aging increases, attitudes towards social solutions improves, and policy support for programs and funding grows. So if we don't want to talk about aging, we most certainly aren't going to want to invest in aging. So when we all tell the same story about our different vantage points in the aging field, we'll start to see that communicators will tend to lead people to talking differently, more positively. We're all aging. Let's talk about aging in an inclusive way. And when we start to talk and think different about aging, we're going to see that behavior change. People are saying, you know what, we do need that policy. Let's invest in that program. And we'll start to see that system change. So let's talk about those cultural models on the next slide let's talk about the cultural models that will drive the way that we think and talk about aging. So we all rely on cultural models in the absence of expert knowledge about an issue. The public defaults to culturally dominant assumptions about the world and how it works to reason about unfamiliar or complicated issues or ideas. So I don't know if your mom ever told you she fibbed to you about something and said, "Oh, this is why the sky is blue." I believed everything my mom said when I was growing up, and if somebody didn't tell me until I was way older, I thought that forever. So that's the same thing. If we don't know anything different, we're going to just lean on what the public tells us to shape our understanding. And that's what we want to dive into here. So on the next slide, we're going to learn about what research took from all this information, and they're going to put it in two buckets. And that's what they did for us. They put one bucket strategies that we want to avoid, and then the next bucket strategies that we want to advance based on what these cultural models were. So on the next slide, you'll see on one side we have what to avoid, and some of these are like individualism. This person isn't aging at home because they made terrible lifestyle choices. That's their fault. Us versus them. Oh, well, I'm not aging. That's a them problem. That's their problem. I'm not doing that. Ideal versus perceived reality. So either you're staying active and you're a super person growing up and you can run miles and do marathons when you're 90s, or you're deteriorating when you're over 65. You have no control and no way to depend on yourself to care for yourself. The next one is nostalgia and threat of modernity. So the family is going to change, and there's going to be this crazy economical challenge, and everything is doomed, and that goes right into fatalism. There's nothing that we can do about this. This is way too big of a problem. I don't want to invest in it. I don't even want to talk about it. So what do we do about that? Here are the patterns that we want to advance. This is what the research found. The first strategy to advance is what surrounds us and shapes us. The environments and contexts in which we live affect our lives and our outcomes. You may have already heard about this concept as a social determinant of health. The second strategy to advance is the concept of collective responsibility. We are all aging and we all have a stake in aging. We can all see each other as interconnected. The third strategy to advance is that problems can be solved. We've already solved the big societal problems like smoking and indoors. A lack of recognition of the contributions of older people and the supports we need as we age is challenging, but it's a problem that we can solve. We've done this before, we can do it again. These strategies to advance may be less dominant in public thinking, but it's our job as framers to activate them and to really start to use them to reach our communication goals. So on the next slide, we have a video that I'm going to cross my fingers works. That'll help explain this a little better. And if it doesn't, I'm going to send you a link to a whole playlist of these videos. Is it maybe the button on the, yeah. No, no big deal. I'm going to send you a link to these videos. It's going to go into in depth a little more on what I just explained in a much prettier way, I'm sure. And there's an entire playlist of different topics that I'll share at the end of this presentation with these videos. So on the next slide, we're going to highlight um, some of these traps that we wanted to avoid. So that individualism, um, I I shared that people aren't aging, but that we say people are made these life decisions. It's their fault that they're not able to age in place or that they don't have access to transportation services. They should learn how to use a phone, and maybe they'll be able to get around more. Us versus them. I don't need to talk about aging because I'm not growing older. I don't need access to Medicare yet. I don't need access um to transportation to my appointments, or that fatalism that I shared earlier. We're not going to um, deal with this problem. It's way too big. The government's not going to let me in. It's way too many resources. So on the next one, we're going to take a little deeper dive into those strategies to advance. What are these big patterns? So there's three really big important patterns of thinking that the public has that we need to try to activate. These are patterns of thinking that tend to be a little more deeply buried than the traps are, but when we as communicators understand them, we can start to cue them up in our communications and really start to um, build momentum on what we're doing here, which is our first one here. So we're going to dive into these a little deeper. I'll highlight them briefly. The first one is to use the strategy of building momentum. So talk about the process of aging as something that's helping move us forward. Then we're going to talk about explaining the supports that we need to live meaningful lives as we age. Really hone in on the big picture. And then we're going to include and highlight those solutions. So we always want to know a solution, right? We don't want to just say, we should do this and then walk away and not give any solutions. So let's get a little more in depth on those. So the first one on the next slide is that building momentum metaphor to talk about aging. So this is the idea that we're communicating that we want to talk about how we are aging, that we're gaining new insights, new wisdom, and new experiences as we age, and that we can use all that to contribute to our communities. And we as communities need to be seeing that as an untapped resource. Yes, I want all this extra knowledge. I want to know everything that you know, and I want to build my community off of that. And I want to raise my community up with that. You can see that there's like a different feel and energy with this in the slide, the couple slides before that, right? It's way too big of a problem. I don't want to deal with it. You know what? That's not a problem at all. I want this person to share with me their education, their understanding. How do we make our community better? When we do this well, we can have a big impact on people's attitudes and implicit biases towards older people. And if we look one more slide over, and then one more click. Okay, so it's a different way of talking about aging that dominates in our society. This different story is more positive and energizing. It helps open our understanding that as we age, we become so much more diverse, that it's not just about death and decline. It's about growing and having these wonderful new experiences. The use of we and us language in this strategy and others that follow is critically important as well. It's one of the most effective ways to help people see themselves as part of our work. That it's all about us. We're all aging. We all have a stake in this. This, coupled with the building momentum language, helps reduce bias and steer people away from othering older people. And we can see an example of this on the next slide. This is a really popular example. I'll put in the chat when we're um, done here the link to the full story. But I'll give you a brief overview of the story. This is an Age Strong Boston campaign from our colleagues over in Boston. They had this shuttle that nobody was tapping into. Nobody wanted to use the senior shuttle. Nobody wanted to access this resources. Nobody wanted to be seen in this shuttle. And they said that it was embarrassing that they weren't seniors and that they don't want to be on the shuttle. They would rather take the bus, which sometimes was unreliable. So they did a rebranding on the bus and made a simple change. They kept the bus from looking just black and white, and they updated it similar to how public transportation buses are. They have branding, they have logos, and they changed it from a senior shuttle to transporting Boston's most experienced people. And it made a huge difference. Tons of people started to use the bus. People were more engaged at the center where the bus would pick people up. And it was a simple but impactful change. All right, let's check another strategy here. The next strategy on the next slide. Explain what our society needs to look like so that each and every one of us has what we need to live meaningful lives as we age, no matter what our circumstances are. We can also use this as an opportunity to share that we all rely on supports throughout our lives. We are all using these supports. If you click one more time, you'll see what it does. When we're doing this well, it helps tap into the idea that we are interconnected. We have the responsibility to be engaged in solutions, and we have a benefit in doing so. We can start to steer away from those otherings. We have the cues for that collective responsibility that I've been sharing with you all. And I'm going to show you an example of that on the next slide. We are all benefiting from these resources. The curb cut. Everybody uses the curb cut at every age. But for some reason, a lot of people think the curb cut is just for the terrible stereotype of aging. Oh, I'm gonna need a walker and a wheelchair and I need the curb cut and it's only for older people. When in fact it's not. It's for that Amazon guy that's gonna deliver your packages later today. I use the curb cut because I gotta use the stroller and there's no way I'm gonna lift that baby over the curb. We all use those curb cuts. Alrighty, and then the next one I'm gonna go over that last strategy. And it's the idea that we're always including and highlighting innovative solutions. So we want to make sure that we prompt that can-do attitude. We're creative, inventive people, and we've solved big problems before, and we're going to do it again. We can think of those solutions when we're communicating with people. We want to have that end game in mind. Start with the solution and then tailor our message around it. You click one more time, you'll see what it does. When we do this, it encourages solutions-oriented thinking, something that's critical as people are incredibly fatalistic that anything can be done. Like I was saying earlier, oh, this problem is way too big. I don't want to deal with it. There's no way I can deal with it. Let's show people, you know what, we can. There's totally a solution. And I'm going to show you an example of what some of our colleagues did over at uh, the O4A Association of Triple A's in the state of Ohio. Her name's Beth Kowalczyk. On the next slide, you'll see that example. There we go. All right, so first she starts with that can-do attitude. Our communities are to tap into this resource by enabling us to be engaged participants. Then she starts to use that building momentum. Everyone is likely to enjoy positive aspects of aging like good health and personal growth, longevity, and expanded productivity. Then she ends her piece here with the solution. We must ensure adequate funding and system resources are dedicated to the full spectrum of supports. We have the link there, but I like to highlight this piece um, as as different from the other pieces because this is a piece of policy or a piece of our community that we're trying to advocate with. And she's really able to use the reframed messaging within this flyer to make her case. And I thought she did a great job of it. All right, so let's take a step back and remind ourselves of what we talked about today on the next slide. So when a frame works, it shifts thinking in multiple ways. So now we know that knowledge increases. We used all that framing, and now we know that people know about implicit bias in aging, and we're changing the way that they understand this topic that we're sharing. And then on the next part, it improves our attitudes. So now we're talking about aging in a positive way. And it's something that and there's programs and policies that we're all going to use. And it's something that we can all use in our communities to uplift. We need those policies. We want that extra solution to uplift our communities. And then when we're all talking about all that, we're going to get that support from policymakers, right? So I always say, you don't want to talk about aging, you want to be negative about aging, no one's going to be positive about policy and the programs. If we're talking about aging, if we're excited about aging, we're going to see that same excitement from policies and programs and the investment in it. All right, so Alicia, you gave me a lot of information today. How am I supposed to incorporate it into my work? So on the next couple of slides, you'll see some resources. So the first set of resources that I like to share on the next slide is I call these our foundational resources at the National Center. A good place to start is the Quick Start Guide. The Quick Start Guide gives you quick flyer version of what I said today, what we want to avoid and what we want to advance, and some quick examples on how to do that. It's a good place to start. I know a lot of folks that use the Quick Start Guide with one of their frequently shared outreach materials, maybe something that you use a lot. They check to see what they have going on and then how they can update it with the Quick Start Guide. It's a great place to start. Next place is our Learning Center. In the Learning Center, you'll see a ton of resources, webinars, videos, um, handouts, trainings, whatever is the latest from the National Center. I love the Learning Center because that's always going to be the newest resources and the most in-depth resources as well. The Caravan is my baby because it is the newsletter that I run every other month. I'll run everything that we're doing that's brand new within the National Center, but also in the movement to reframe aging. So what are the newest podcasts? What are people doing within their own communities? Of course, what are we doing, and where are we going to see you at the next conference, and how can we connect? I always recommend subscribing to the Caravan so that you can make sure that you're up to date with the latest in the center. Words Matter is, or the Words Matter page is our YouTube page. This is where all those frame of mind videos are at. And let me make sure that I throw that in the chat too, since we didn't get to see it. So the frame of mind videos and other videos on there are going to give you a short and fun overview of what I shared today. We're going to get a little more in depth. They're going to show you those different topics, and they're about 2 minutes long per video, and they're really exciting to see in action. On the next slide here, those are the stories from our partners. There's quite a few these stories, and this is really showing people how people are applying these tools within their own organizations. And this is across the board. So you'll see some budgetary support that people use reframing with. You'll see people in healthcare settings, how they were able to do that, how people were able to have some policy change, some examples from state units on aging. There's really great to see the diverse ways that people are using these strategies within their own work to make a difference. And then, of course, I always like to share what we have upcoming. We have on the next slide here, our 100th Day of School webinar. That'll be the 27th at 1 p.m. Eastern Time. So if you're not familiar with the 100th Day of School, a lot of elementary school celebrate the 100th Day of School, but they do so by encouraging students to dress up as centenarians. And the problem with that is they encourage students to do so without the education of what it is to age, and it ends up turning into kids coming to school dressed up as negative stereotypes of aging, and that continues to enforce that early ageism that we talked about today. So we've created a toolkit for people to be able to use, educators, parents, advocates, on how we can celebrate the 100th day of school in a more age inclusive way, and also to be able to educate students about what it is to age, and without using the implicit bias and what we are seeing in society about aging. I'm very excited about that. Feel free to register. We'd be very excited to see you there. Okay, so on the next slide, I just want to take a minute to circle back to what we talked about at the beginning. We're all part of this work. We all have the ability to contribute to this work, and we all have a role to play in this work. We're cultivating a movement of individuals and initiatives. You can see these circles, the empty ones. I hope that you can see where you are now within here, and your influence is within your own personal and professional life, and how you can continue to move this movement forward with us and to join the movement. And you are all a part of this network. So on the next slide, I want to make sure that you remember there's a lot going on, and I know that as soon as the day starts to end, I shift my mind to think about, all right, what's everybody need from me for the rest of the day? So I encourage everybody to show yourself some love, and could you February 14th, Valentine's Day, on your calendar, and remind yourself, what have I done to reframe aging this month? If I hit that goal, am I doing something with that webinar that I sat in on? What resources do I still need? Maybe I had an idea throughout the month. I want to reach out to that team and see what they think about my idea. Reach out to us. Make sure that you're able to use the resources. You have questions about the resources, let me know. And that is the end of our presentation. The next slide, you'll see my information if you'd like to reach out to me directly. And if you
That's
have any questions, please feel free to let us know.
Thank you so much, Alicia. This has been terrific. It's such a good reminder of how we need to think, how we need to change our thinking, and how we can do that, and just really practical advice for doing that. So let's take the slides down for the discussion part. And there was something that you mentioned early on, so I'm going to take the liberty while folks are thinking of their questions, because I haven't seen any in the chat yet. But I wanted to bring up the topic of super agers, right? So we see sometimes older people depicted as, amazing athletes, and it's like you can do this, and people that swim, across the English Channel or whatever at 98, which is good and it's amazing, but it's not necessarily for all of us. I'm just wondering how, if you all have thought about that, and what's a good way to be thinking about and addressing the topic of super agers.
Yeah. So I don't want to not share these stories, right? But I don't want these to be the main focus, right? Because that's not how we are all aging. We're all aging in diverse and different ways. I most certainly can't run a marathon, but that doesn't mean that I'm not aging healthily, right? So I tried to share across the spectrum, right? Different abilities, different stories, different ways that we're aging, ways that we need support, and I make it an us collective thing because we're all aging in different ways. So I don't want to just hone in on that one part. I want to keep that big picture in view when I'm talking about different solutions and ways to move forward.
Okay, so if I'm hearing you correctly, that's just one way to age, and there are lots of
Exactly.
different ways that we're all going to age differently. Okay.
Exactly. And from a policy perspective, if I say, you know what? We're all aging like superheroes. We don't need extra supports. Then we're gonna hit a wall there. So I try to keep that all very diverse. Exactly.
Yeah, no, I appreciate that. That's really good advice. Okay, there's one question in the chat, and then Margaret, I'll get to you. So the question from Gina is, can we use these slides when we do training and education about ageism in our community? So we're going to send the slides out, but folks want to know if they can kind of reuse some of the information that's on your slides.
A lot of people use the resources as when they're sharing within our community because some of these slides can be a um a little vague if you look at them to kind of delve in. So I usually recommend people use the resource link that I gave, and there's the quick start guide. You'll be able to see the frame of mind videos that you're welcome to put into your presentations as well. And if you need access to other resources, you want to talk more about educating your community, please feel free to reach out to us. We could chat more about it.
Thanks for that. And I will say that I have used the Boston um, transportation picture. I've used that in multiple
Yeah.
sessions or presentations myself. So I know you can find that one somewhere. And
Yeah, you'll
also,
see it on
yeah,
the impact stories.
yes. And also, a lot of you have already worked with the National Center to Reframe Aging and had Alicia or one of her colleagues come and present to your organization. So I just want to put that out there. Alicia, you guys have been just super accessible and very flexible, and we appreciate your connecting with some of our partners as well. So,
Absolutely.
Margaret, what is
Get
your
my
question
information here.
or
So,
comment?
yeah, thanks very much. Thanks for the presentation. I'll make a confession. I am a certified trainer through Reframing Aging. So, but my training was years ago, and things have evolved over time as more information has been developed and people got more engaged in it. There is a term that I see being used more and more, and it is not older adult, not what we tended to use in the reframing aging world, but late and later adulthood. So does the National Center have an opinion on that emerging language, which I see a lot in the healthcare and social support literature? Has there been some discussion about viewing it that way? And I will share that I think it provides some opportunity for people to see it somewhat differently, but I'm wondering if maybe frameworks has analyzed how that term lands when people hear it.
That's a great question. And we have been talking with frameworks because there's so many different ways for people to talk about different parts of our lifespan as we age. And we even don't even say older adults anymore. We say older people. So, and this is continuing to change. And what we as a team kind of were figuring out was the best way to move forward was to use what works the best or what flows with your communication the best, because the thing that we want to focus on was the actual strategies and refocus our mind on the solutions and that collective responsibility, because no matter how the terminology changes within the community, if we kind of get ourselves stuck on different terms, we forget about that collective responsibility and that building momentum metaphors. And some people and it keeps us from going down the rabbit hole. I'm sure that some of you might have run into this as well. Some people want to be called senior, or some people want to be called elder. And so then we kind of go down a different road with that. So if we, as long as you focus in on those strategies, those other terms will kind of flow with you.
Thanks.
Absolutely.
Thanks. Yeah, and that brings up a really good question about culture and how important culture is when we're communicating and thinking about if you're communicating with a tribal community, the term elder is a term of respect and wisdom, and so we don't want to take that term away either. So really, really good perspective. Great question, Margaret. I have not heard that terminology before, so really interesting. So there have been a couple questions in the chat. One is, this is shocking. I was called grandma by my young boss and I was floored. How do you deal with that?
Yeah, lots of folks have been dealing with things like that, and this is discrimination. So my work self tells you to that's an HR issue, but I would also challenge and say, well, what do you think is a grandma? Is it because I have grandchildren? Is it because that's what a grandma is, right? Someone who has grandchildren, and that's quite the badge to wear. But if you're not being referred to grandma for your grandchildren or within your family as a earned name, then that's a form of discrimination to be addressed.
Yeah, that's a tough one. I'm not sure how I do that. I think I might, yeah, I might say, hey, I'm not a grandma yet, so back off. Uh,
Right,
other
and that might
questions?
just
So,
be something that family would call.
yeah, it could be, or you could just ask someone, hey, why'd you call me that? That might be just a friendly way of just saying, hey, why'd you do that? Why do you see me that way? So a couple of other comments here. I see the term advanced aging in some demography literature. So advanced aging.
Mhm.
I've seen research from your organization that shows research of why we encourage certain words versus others. The research was regarding perceptions of competence. I don't know if you could address that,
Perceptions
Alicia.
of competence. I'm trying to think of
I can
what.
address that one because I'm old enough to remember when the data was originally drawn. I've been certified for a long time. So Frameworks did research probably 15 years ago now, looking at how certain terms were interpreted by people. And when they heard, when people, and they have, used to have wonderful video, Alicia, I'm sure it's still available in the files, where they interviewed people in cities around the country and said, what comes to mind when you think of the term elderly? What comes to mind when you think of the term old person? What comes to mind when you think of the term grandma? And people talked about frailty and dependence and no longer being able to execute activities by themselves, all these negative images. And that is where frameworks originally began to suggest a term older adulthood or older adults because it's more inclusive. It was not associated by the majority of the population with frailty and dependence. Notwithstanding, as you've just discussed, there were clear discoveries that in certain populations, the term elder is a term of great respect, earned respect. But at the time, the terms elderly, older grandma were associated with very negative images. And that's where the term older adulthood and the push to use the term older adults, older people emerged, was as a substitute for those terms which we culturally tend to associate with very negative
Right.
images.
Right. And we also want to think more about the strategy behind that too. So we were talking about that individualism and, oh, well, if you're older, then you probably can't make decisions for yourself and you should probably get a healthcare decision maker. And it's thinking, well, actually we're all aging, and what's going on around us, and how can we support each other, and what are we all doing? So it's shifting the way that we're talking about aging too. And I always try to remind people to not get stuck on specific words, but really think about the strategies And we've talked a lot. We talked earlier, I believe, in the chat too about that competence. And oh, well, if you're older, you don't have the competence to be president. You don't have the competence to hold office, and we should have limits on how old people should be when they run for office, which I believe was passed. I forget which state passed it earlier last year, but it's on our website. You'll see it. There was an article that I shared about it in the caravan.
And
Great
there's
question.
another Kelly had a comment about data, survey data, and data collection. And we see this. This is so common where
Hmm.
the population will be divided into 10-year increments until you get to 65, and then it's everything over 65. And this is a real problem because as a 67-year-old, I do not share the same health as a 35-year-old or an 85-year-old. And we were not homogenous 65 and up. And so I don't know if anybody else on the call wants to address that, or Alicia, if you have thoughts about that as well, that it is a problem in data, and it's a problem with organizations and agencies that collect data. I was made aware recently of an international data set that stops at 75, and that just seems so arbitrary, but it's just what they've always done. So anyway, I don't know if Alicia, if you have thoughts about it, or others.
Yeah, yeah. I mean, it's the largest group that we have that when we collect data, and that's such a big group, right? The needs of somebody between 65 and 75 is going to be totally different for somebody that might be between 95 and 105, right? And
Mhm.
and that's part of that policy change, I feel, is if we're not talking about aging, people are just going to write people off. Well, that's others, those are them, they're older. I don't want to deal with that group. We're going to focus on these other groups and get those smaller intervals to see what the needs are. So I definitely feel that that is part of a necessary policy change.
Yeah, yeah. And I mean, it varies state to state as well. And it varies government agency to government agency. I think a lot of CDC data starts at 65 and up, but when you're talking about the Older Americans Act, it's 60 and above. So it really varies. There's another comment here. Instead of healthy aging, does anyone use healthy longevity to shy away from older?
Healthy, super is that
You know,
comment.
when I think of longevity, I think of that's kind of the lifespan. It's like we're thinking of how long we live. So I don't know. I'm not. I feel like that might be a little awkward, but who knows? Oh, thank you, Katie. North Dakota set age limits for U.S. congressional candidates that would prevent
There it
anyone
is.
running for Congress if they turn 81 during their term. Wow.
That's the one.
Wow.
Yeah, we had a article or that went out about that last year too, because it was all around that same time where they were calling for mental capacity tests. And
Yeah. Other questions or comments for Alicia?
I'm going to take a point of privilege and ask Alicia to comment on the update that you all are working on regarding the definition of ageism in dictionary, and how I think it is dictionary spread, and how you're contacting
Mhm.
them, refreshing and
We
updating
did,
them.
and they up absolutely. Thanks for bringing that up. We were able to contact Merriam-Webster and Oxford, and Merriam-Webster is still working on it. They have a few more loopholes to go through, but the Oxford Dictionary did update their definition of ageism. So it was brought to our attention that the definition of ageism was discrimination against the elderly, which in itself had ageism in it, right? Because ageism, anybody could be, you can be ageist to somebody, in high school, or you can be, maybe like an internal where you can't do this job because
Yeah.
you aren't old enough to understand this issue versus ageism, at any age of life. So we contacted them, and we had a petition with a number of organizations and individuals, advocates who signed on, and we were able to update that. So it just said discrimination based on age. It gets to the point, and we're
Yep.
not including that ageist language within the definition of ageism, which was a great change for us to be able to make.
I love it. Any other questions or comments?
I encourage everybody to check out those resources. If you think of any questions along the way, I put my information in the chat as well, that you're please reach out to me. I'm on the West Coast, and I have a 10-month-old, so I'm literally awake always.
Thanks so much, Alicia. This was really great. Such a great conversation always with you and your colleagues. Really appreciate your being here with us. I'm going to turn the presentation back over to Karan to close us out.
Thank you so much, Alicia. I remember when that Webster's note came out, I was teaching a class and I shared it with them, and it's like, wow, we didn't even think about that, but it's a great update. And I follow and make sure I keep up with all the letters and things that are being sent out. So thank you all for attending today. And again, we're kicking off our 2025 series of trainings. So our next training will be on February 20th at 3 p.m. Eastern Standard Time. You will be able to find the information to register for that, or you can just register in advance for all the trainings for the year by using the link in events. And if you are pursuing AFPHS champion recognition, please take a minute to pause this training to track that you have attended this particular training, either in live or in person. So if you are on our call right now and you are pursuing champion designation, please let us know that you attended this training by navigating to that website or accessing the QR code. And if you're viewing this as a recording, please pause and just make sure you complete the survey to let us know that you have attended and viewed this training. I'll wait just one second. And thank you all for attending today.
Thanks, everyone. See you next month.
Thank you.